Hello students, today we are going to discuss about the scapula bone. Okay, this is the scapula bone what you are seeing, and this is also called shoulder blade. Shoulder blade. Okay, this is a very important bone. It is related to the shoulder girdle, especially the posterior part of the shoulder girdle. It is formed by the scapula bone, right? Here it consists of, it is a flat bone. It consists of different parts. First you see about the and many trees here. Okay, see, this is the first one is the three borders. This is the medial border, this is the lateral border, and this is the superior border, right? And next three processes. That is this is called spinous process. This is called acromial process, and this is called coracoid process. Coracoid process. Okay, the three processes, three borders, and three angles. Okay, this is called superior angle, and this is called lateral angle, and this is called inferior angle. And here it is also having three fossa. This is called supraspinous fossa, this is called infraspinous fossa, and this is called subscapular fossa. Subscapular fossa. Cool. See, three fossa and three borders, three processes, three angles, and three surfaces. Okay, that is the important point. Next we see one by one. First you see about the borders. This is the medial border. This medial border, it is thin when compared with the lateral border, and this medial border, it provides insertion to the muscles. It is monopolized by insertions of the muscles. What are the muscles gets inserted along the medial border? Here in the dorsal surface, the first one is here there is an important muscle that is called levator scapulae muscle gets inserted here. Then here teres minor muscle, and next here teres major muscle. And next in the ventral surface, ventral part of this medial border, entire border, it provides insertion to the our important muscle, that is the serratus anterior muscle. Serratus anterior muscle gets inserted. So all the parts of all the areas of this medial border, it is providing insertions to the muscles. Next coming to the superior border. Okay, this is the superior border. The superior border, it is having a special structure in the superior border. Here this part is called suprascapular notch. Suprascapular notch. In living conditions, the suprascapular notch, it is bridged by a ligament like this. This is called suprascapular ligament. And above the suprascapular ligament, that is suprascapular vessels passes, and below the ligament, that is the suprascapular nerve passes. Suprascapular nerve passes. And apart from this, this area along with the suprascapular notch and the suprascapular ligament, this area, it provides origin to the one important muscle that is called inferior belly of the homohyoid muscle. Inferior belly of the homohyoid muscle. Okay, so that is the superior border. And next coming to the lateral border. Okay, this is the lateral border, and this lateral border is thicker when compared with the medial border, because this is the area it is providing origin to the muscles. Origin to the muscles, and these muscles, they are acting against the gravity, anti-gravity muscles. That is why this border is thicker when compared with the medial border. Medial border is thin and the lateral border is thick. You see, you can observe here. Right here, this medial border, okay, and at the junction of the medial border and superior border, here there is a one depressed articular area, fossa. This is called glenoid fossa. It articulates with the head of the humerus. Then it takes part in the formation of shoulder joint or glenohumeral joint. Glenohumeral joint. And this supraglenoid tubercle. What is supraglenoid tubercle? Here there is a bony prominence or elevation area over the glenoid tubercle and the glenoid notch. This is called supraglenoid tubercle. This provides origin to the long head of the biceps muscle. Long head of the biceps muscle. And below the glenoid notch also, here you will get another small bony prominence. And this is called infraglenoid tubercle. Infraglenoid tubercle. This infraglenoid tubercle also provides origin to the another important muscle, that is a long head of the triceps muscle. Long head of the triceps muscle. And here below this area, here it provides origin to the teres minor muscle, and in below part, lower part, it provides origin to the teres major muscle. Teres major muscle, teres minor muscle, long head of the triceps and long head of the biceps. These are all the muscles taking origin from this area. And next, this is the inferior angle. In the inferior angle, it is also providing a small part of the origin to the small part of the latissimus dorsi muscle. And here, if you see the processes, this is the spinous process, this is the acromion process, this is the coracoid process, right? These three processes. Between the spinous process, above the spinous process and below the spinous process, we will get a fossa or depression. So this is called supraspinous fossa, and the supraspinous fossa, it provides origin, especially the lateral 2/3. It provides origin to the supraspinatus muscle. Supraspinatus muscle, then it goes laterally, then it gets inserted to the, there is a greater tubercle of the humerus. Next, below the spinous process, here this area is called infraspinous fossa. This infraspinous fossa also provides origin, especially medial 2/3. It provides origin to the another muscle that is called infraspinatus muscle. Infraspinatus muscle, it also goes and it inserts to the this greater tubercle, right? And next, this is the supraspinous fossa and this is the infraspinous fossa. In between, this is the spinous process, right? And here there is another fossa. This is the subscapular fossa. Subscapular fossa, and this subscapular fossa also provides origin to an important muscle that is called subscapularis muscle. And this is an anti-gravity muscle. That is why you can see, observe here, these are the ridges in the subscapular fossa. This because of the segmentation of the muscles, it provides origin. Okay, that is the subscapular fossa. This is the supraspinous fossa, this is the infraspinous fossa. Okay, from all these three fossa, there are three muscles that are coming and they gets inserted to the humerus bone, then around the shoulder joint. Okay, these are all the muscles, they are taking origin from the supraspinous, infraspinous and subscapular fossa. Next, coming to this spinous process. The spinous process, it is having superior surface, inferior surface and lip. They are crest. Okay, this is the crest. This crest of the spinous process, it is having upper lip and lower lip. This lower lip of the spinous process along with the lateral surface of the acromion process. This is the lateral surface, the continuation. It provides origin to the deltoid muscle, and this upper lip of this one, it provides insertion to the trapezius muscle. It gets inserted here. Then this is the acromion process. This is called acromion process. This acromion process, it is having superior surface, inferior surface, and lateral border and medial border. This lateral border, it is providing origin to the deltoid, especially the middle fibers of the deltoid muscle. And this posterior medial surface, it provides insertion to the trapezius muscle. And here just posterior to the tip of this acromion process, you will get the depression, articular area. This area, it articulates with the clavicle, then it takes part in the formation of acromioclavicular joint. And this inferior surface of this acromion process, it protects the shoulder joint. Then this tip of the acromion process, it is connected to the coracoid process by a ligament that is called coracoacromial ligament like this. Then this coracoid process and acromial process along with this ligament, all these three structures, they forms like a hood-like structure above the shoulder joint. Then they prevent superior dislocation of the shoulder joint. Okay, you see here like this. It won't allow the dislocation of this shoulder joint above because of presence of this hood-like structure. Okay, that is another important point. Next, coming to the coracoid process. This coracoid process, it is a bent finger-like structure like this. Then it is also very important because even though it is a small process, it produces attachments to the many structures. That is, especially 6 structures gets attached to this coracoid process. That is 3 muscles and 3 ligaments. What are the muscles which are attached to the coracoid process? That is, first one is it is providing origin to an important muscle that is called coracobrachialis muscle. Coracobrachialis muscle takes origin from here. And next is another muscle, that is a short head of the biceps muscle, also takes origin from here. And next one muscle gets inserted to especially to this anterior border. Here, this is the area, it provides insertion to the one important muscle that is called pectoralis minor muscle. Pectoralis muscle, minor muscle gets inserted here. So it is a coracoid process. It is providing three muscles and attachment to the three muscles. Out of this, first one and two are the origin. So that is coracobrachialis origin and short head of the biceps origin. And another muscle gets inserted. That is the pectoralis minor muscle gets inserted. So three muscles. Next, it also provides attachment to the three ligaments. So already I told you one ligament. There is a coracoacromial ligament between the coracoid process and acromial process. Then there is another ligament between the clavicle and the coracoid process. Especially that is here like this. You can lower end of the lower surface of the or inferior surface of the lateral 1/3 of the clavicle. Will get there are two structures. That is a conoid tubercle and trapezoid ridge. These conoid tubercle and trapezoid ridge, they are providing attachment to an important ligament that is called coracoclavicular ligament. Coracoclavicular ligament. This coracoclavicular ligament, clinically it is very important because this is the very important ligament. It bears the total weight of the, or it transmits the total weight of the upper limb to the clavicle, especially medial two-thirds of the clavicle. Then it is transmitted to the axial skeleton. Okay, that is why this coracoid process and this clavicle, between these two there is a one ligament that is called coracoclavicular ligament. This is a very important ligament. That is another ligament. Next, between the coracoid process and the humerus also there is a one ligament. This is called like this. This is towards the greater tubercle. Here there is one ligament that is called coracohumeral ligament. Coracohumeral ligament between the coracoid process and the greater tubercle of the humerus. Like this, there is a one ligament that is called coracohumeral ligament. So this coracoid process, it is providing attachment to the three ligaments. What are the three ligaments? First, coracoacromial ligament. Next, coracoclavicular ligament to the clavicle. And next, coracohumeral ligament to the humerus. So these are the three muscles and three ligaments which are attached to the coracoid process. Okay, these are all the some important points related to the scapular bone. Okay, thank you.